Now, so we're just going to go through how we can engage our core, how we can practice our breathing while engaging our core and holding neutral pelvis, and take us through some basic exercises. So first thing to help, it would be to think about trying to squeeze your bum, as in your anus. So if you squeeze your bum, you can feel the muscles in around the pelvic floor slightly engage. So that's one way to engage your core from the back part of your pelvic floor. So you might squeeze it, then relax, then squeeze it, then relax. So you can practice that to get the feel of it. The other way to try and get your front, the core at the front, is if you take your two fingers, slide them in from your hip bones and down an inch, and then see, can you turn on the muscles just underneath your fingertips. So we don't want to turn it on really high. We just want to feel about, a movement or a sensation of the muscles turning on. Then we relax them, then we turn them on, then we relax them. And again, we're just trying to practice that to get a connection between the brain and the muscles, if we haven't really tuned in with them for quite a while. And then you can start to do it whereby you're engaging those core muscles and squeeze the bum to get the pelvic floor muscles. So we're doing the whole area at the same time. And again, you can turn it up really high or just let it go down really low, okay? And then build it up slowly. Think like an elevator, you're going up, 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 and then relaxing everything. Or then you're doing a pulse, turn it on, turn it off, turn it on, turn it off. The other component to this is trying to breathe while you're doing this. So that can be quite challenging for people, trying to differentiate or separate their diaphragm from their pelvic floor and their core. So we'll just work off the core muscles first. So if you sink the fingers in again into your tummy there and just lightly turn it on. Now, see, can you turn it on and count out loud to 5? 1, 2, 3, 4, 5. If you find you have to take a deep breath or breathe in and then you lose control or you lose the contraction, that's what we're trying to achieve. We're trying to see, can we lightly control or contract while we do our breathing? If we're bracing too hard or contracting too hard, well, then we're like this and we can't breathe at all because everything is locked down and we've got a lot of pressure building up. So see, can you simply turn it on 5%, 10%, whatever it is, and still be able to talk and breathe. And we really want to practice that. So you can practice that anywhere. You can practice these lying down like this. You can practice them sitting. If you're driving, stop at the lights, you might turn it on, turn it off, turn it on and sing a song, and just really start to control that a little bit more. From getting the pelvic floor to work a bit more, you can also do these when you're going to the toilet. See, can you stop the flow, then release it, stop it again, and release it. Again, you can be doing them like pulses, pulse on, pulse off, pulse on, pulse off. You can do them where you might stop and hold for a count of 3, then relax. You might do it where it's 10% build contraction, 20%, 50%, 100%. So you're just playing around with the different levels of how you can contract it. Okay, so then the next piece is to add in a bit of movement while we have the contraction on. So we're learning to contract the core first, then we're learning to contract and breathe. Now we're going to learn to contract and move. So same again, 2 fingers in on the tummy, lightly feel those muscles switch on, then slide your leg out and slide a leg in. Pause, relax, reset, go again, slide the other leg out and slide it back in. So while we're moving, we're trying to see, can we control it, okay? If you find once you start to move, you lose control, again, that's something to practice for yourself. The other movement you can try is to have your 2 legs bent up, engage the core, and you just let one knee fall out to the side, bring it back up, then you let the other leg fall out to the side and bring it back up. And you're trying to make sure you're keeping the pelvis level, that when the leg goes to the right, the pelvis doesn't roll out to the right, okay? You're trying to keep the hips level, like you have a spirit level across the front of your waist there. You're trying to keep it level. Imagine you've got a little glass of water balanced on top of your left knee as you lower your right knee out to the side. And you can do 5 or 6 just on the right. And then you can do 5 or 6 just on the left. Okay, now, while you're practicing contracting and moving, See, can you do that while breathing? All right. So now we've got all three elements working at the same. We're contracting, we're moving, but we're also breathing. So I'm not going blue in the face, concentrating on contracting and moving the leg and not breathe. Okay. So I'm not even going to tell you when to breathe in, when to breathe out. Just learn to breathe. That'll do you. Okay. The next thing I want us to try is a pelvic tilt. Lying flat on our backs. We're going to roll the hips back, push through our feet and peel our spine to the ceiling. Pause at the top and roll back down. Okay. So again, we're getting a slight bit of contraction through the core, a bit of the pelvic floor, and we're lifting. So you might try 10 of these. Okay. Another nice one to try is our toe taps. One leg in the air. We tap that down 10 times. Then we switch and tap the other one down 10 times. And all the while we're thinking about contracting our core, we're thinking about breathing. So these are next stage exercises to try. And then a real difficult version of that, which shows you how difficult it can all get, is to extend one leg while you've got two legs in tabletop. So now you have to obviously have a bigger contraction through your abdominals and your core while we're now moving the leg. And then we also have to breathe, okay? So it can get quite complex, but just focus on the simple stuff first, which is the first 5 or 10 minutes of this video. Then we can turn on our side and we can do some side leg raises. So we're lying flat like so. So this time we're gonna contract the core, but we're doing it at a different angle. So we've got our pelvis stacked, hips are stacked. Engaging that core the same way we would. You can also do a bit of the contracting at the back, and we're going to lift that leg up and down. Okay. If you need to, you can place your top hand on the floor, and we're just going to do 10 lifts up and down like this. So these are nice to do as an alternative. You can also bend your lower leg again, making it a bit easier to stabilize the pelvis and everything else. Okay. So you can either use your hand, bend up your leg, and then as you're getting stronger, see, can you lie perfectly still as you lift that leg up and down. You might do 10 reps on each side. We can do nice little clams, bend those knees, feet stay together, and we lift that top knee up and down. Okay, they're nice to do. Another nice one to do, again, changing the dynamic of where we're engaging from, is we go onto all fours, and we think about drawing the belly button in slightly as we engage that core. So again, this is when you've really learned how to switch it on and switch it off without really needing your own fingers to feel or palpate for the contraction. And we're just going to do this. Opposite arm, opposite leg. Extends out long. Nice and smooth transitions. But again, these are later on to try. I would really try and get to terms with how you're contracting through your core, seeing if you're getting a better control of your pelvic floor muscles, obviously less waterworks issues, and just continue to practice that. Again, if you don't get to do anything else, just see, can you stop your flow when you're in the toilet or going to the toilet? And that involves the same muscle groups. So if you can learn to stop the flow, release, stop, release, you're doing the same thing, and then just practice it throughout your day. See you on the next one.